We begin with a major development on the latest Republican effort to repeal and replace Obamacare. Senator John McCain just released a statement saying that he cannot support Senator Lindsey Graham and Bill Cassidy's health care bill. And it reads, "I cannot in good conscience vote for the Graham-Cassidy proposal. I believe we could do better working together, Republicans and Democrats, and have not yet really tried." Let's bring in CBS News political director Steve Chaggaris to help us break all this down. So, Steve, he says he wants Republicans and Democrats to work together. Do you think that's going to happen?
Good luck with that. I mean, that's clearly not the case right now. There was some effort to do that with Lamar Alexander and Patty Murray, Republican and Democrat, trying to put together some sort of bipartisan health care bill. But that's done. They're not working on that anymore. So this is the only vehicle. And John McCain saying no to this is now the second hard no among Republicans. And one more kills this thing. So we're watching very closely Senator Susan Collins of Maine, Senator Lisa Murkowski of Alaska. Another one of those falls, and Susan Collins is leaning no. They're not going to get this thing passed because Democrats are not voting for this at all.
So if you're the White House, Steve, where do they go now? If they want to repeal and replace Obamacare, what are their options?
None. I mean, there really are no options. There were no options until this Graham-Cassidy thing sort of showed up again recently. But again, keep this in mind. There's a procedural rule that expires at the end of next week on September 30th that allows Republicans to pass a bill like this with just a simple majority of 50 plus 1. That expires. After that, they would have to pass a bill like this with 60 votes. If they can't even get 50, how are they going to get 60? So this really is their last ditch effort. People are calling it a Hail Mary. And if we're sitting here now 8 days from the deadline and you already have 2 no's among Republicans, the prospects don't look very good for this.
Yeah, they certainly don't look very good. And when you talk about sort of the legislative session, there's a lot still on the plate here for Congress to look at. What else are you looking at? I know tax reform was something they wanted to push forward. Is that also dead on arrival?
No, not yet. They still have to really sort of lay that out for people. What are they thinking in terms of tax reform? What are the details there? You've heard the president talk about it several times over the last few weeks, but not really give too much detail. I think in the next week or so, we're going to get a lot more about what Republicans want to do on tax reform. And I think that's really going to be the next big push here, because it really seems that health care is done. They're going to move on to tax reform after that.
And also, when you're talking about the budget, Steve, they've still kicked down the can on that as well. Remind us on the timeline of that, and what are we looking for this fall?
Yeah, so they passed a short-term spending bill recently, so that gets them through the middle of December. So I think we'll see the next deadline in a couple of months on that, and you know how these things go. Sometimes these things go up to the last minute, so I think in early December we'll start to see a lot of debate over how they're going to deal with a longer-term spending bill, but that's not for a little bit now. I think we've got a few weeks to breathe on that before we have to worry about potential government shutdown. I think December 12th is the deadline on that one.
And you know, Steve, the Graham-Cassidy bill sort of came up also, you know, randomly. It had been percolating, and then they took it sort of seriously. The White House came forward saying they were behind this as well. Do you think that there could be some other option in the healthcare realm that could be presented in the coming months, or is it just completely dead? Well, unlikely.
Keep this in mind. You have to remember when the last bill failed in the Senate, Mitch McConnell, Senate Republican leaders, got a lot of public blame from this president, a lot of ribbing from the president on Twitter, a lot of people of the Steve Bannon ilk and others complaining about Senate Republican leaders not being able to get Obamacare repeal pushed through the Senate, saying that they failed on their promise to voters. And so I think they saw this as another opportunity after all that criticism to try to get something done, especially since the window is closing, as I mentioned, on September 30th, to get something done with a simple majority. But now we're getting, you know, their backs are up against the wall in terms of the calendar, and people are saying no here. I don't see what other options they have between now and the end of the month, and then moving forward to get something done in terms of Obamacare repeal and replace. This is really a sort of last ditch for them, and it's not looking very good.
So despite the fact that you mentioned their backs are up against the wall, do you see any scenario where McConnell brings this up for a vote next week?
Well, you don't know, right? So you still have a couple of maybes. I mean, Susan Collins is leaning no. She would be the third no vote, and that would sort of sink this. But, you know, they might try to pick off a conservative Democrat to see if they can get one Democratic vote to offset that. They may try to give some sweeteners to Collins or to Murkowski from Alaska to see if they can keep them on board as yes votes. So there's going to be a lot of horse trading going on over the next several days. But the way it looks right now, I hate to make this joke, but it's on life support, right? It's on serious life support for them. But they've got a lot of work to do behind the scenes before they put this on the floor. I think if it's very clear that this is not going to pass, then perhaps they don't put it out there. But they still have a little bit of time to try to make some deals with Republicans and maybe a conservative Democrat or two.
All right, we'll be watching next week. Steve Chaggaris, thank you for joining us.
Thanks, Rena.